Well, welcome and good morning. Good morning back. I'm Ed Hunter. I'm the President and CEO of the de Beaumont Foundation. And it's a pleasure to be here today and to join our partners and the communities that have met the Build Health Challenge. I also want to welcome others on the Build communities that are joining us via web stream. And I want to make a point of both to those of you out in webland and those in the room. I know you've heard the hashtag Build Health over the last day. I want to encourage people to tweet things they hear, or people who are in the web world who are observing what's happening to reinforce points that are being made and tell us the story of what's happening in your community. We also have an @build_health address that's in Twitter, and there'll be a conversation that I hope that continues not just during the event but after the event. So we encourage you to be conscious of those who are not here and keep the conversation going both during and after. I want to start with, this is actually a moment to congratulate the recipients of the 18 new Build Health Awards, many of who are in the room and joining us by web. But more than that, it's a moment to celebrate the people and organizations that are coming together to tackle some of our most urgent health problems. As a program, Build brings together 5 key funding partners who recognize the importance of working together and across sectors to stimulate progress. And we're going to hear briefly from each of our 5 this morning. And we're going to be honored to be joined by Dr. Karen DeSalvo, who's going to join us in Progress, who is a leader in the health systems transformation based on some of these same principles. So I'm looking forward to a really interesting discussion, and then continuing this discussion over the year and really learning how your communities are tackling or continuing to tackle the issues. I've really enjoyed hearing some of the stories over breaks and meals over the last 24 hours. So I'm going to start. I have the pleasure of introducing each of the Build funders to make brief remarks. I'm going to talk just a few seconds about each one of them. I could go on at length, but their extended biographies are in your packet. So I encourage you to familiarize yourselves with each of them and their organizations that way. And I'm going to start with Robert Musselwhite, who's the chairman and chief executive officer of the Advisory Board Company. Many of you in attendance were at the Advisory Board building yesterday. The Advisory Board Company provides strategic guidance, actionable insights, web-based software solutions, and comprehensive implementation and management services to several industries, notably hospitals and health systems. Robert, I'm going to turn it to you.
Thanks, Ed. All right, this is very exciting to be here. So on behalf of all of our fellow partners, the Advisory Board Company welcomes you today to the announcement of the funded communities for this first Build Health Challenge. And thank you to our attendees here at the National Press Club in Washington, D.C., and through our live stream at buildhealthchallenge.org. And I'm told the live stream is up and running from some of you who have already gone to take a look. And this is really exciting. This has been over a year in the making from concept phase, and to have it all come together today as a reality, actually yesterday and today as a reality, is tremendously exciting. I know there's still lots to do going forward, but we're all really excited. And on behalf of the Advisory Board Company, I just want to convey how great it is to be here all together today. We're excited to share today how 18 low-income urban communities are applying uniquely innovative collaborations to give everyone a fair chance to be healthy. It is our hope that these collaborations will pave a new way not only for their communities, but for our healthcare system as a whole over the next few years. Build is aimed at increasing the number and the effectiveness of hospital, community, and public health collaborations that improve health at its core. Through our pooled resources, we are awarding 2-year grants and loans worth up to $8.5 million to communities that are engaged in these types of collaborations. These include 7 implementation awards and 11 planning awards. The funded communities exemplify the Build Health Challenge pillars. So it is an acronym: bold, upstream, integrated, local, and data-driven, and have the potential to inform new models for improving healthcare while at the same time lowering healthcare costs. These 5 pillars represent the best thinking from the unique partnership that is supporting the Advisory Board that is supporting Build. We at the Advisory Board Company are excited to be working with the Colorado Health Foundation, the de Beaumont Foundation, the Robert Wood Johnson Foundation, and the Kresge Foundation to launch the Build Health Challenge. It is groundbreaking for a publicly traded company and several foundations to collaborate in this way. Further, we are not aware of any other multi-funder collaborative that has integrated multiple forms of capital, grants and loans, in this way to support neighborhood revitalization. What that means is that loan funds can be used for physical development projects to complement the programmatic activities funded by grants. Just as we and the 4 other funders of this initiative represent different approaches to solving key problems, the collaborations receiving Build Health Challenge grants are stronger and more robust because of the different strengths and perspectives each player brings to the partnership. The funded communities range from coast to coast and represent the most promising collaborations from more than 300 first-round submissions that we winnowed to 51 finalist communities. So this was very competitive. The timing of the Build Health Challenge has never been more critical, as states, regions, and communities are experimenting with models that produce better health outcomes and lower costs. At the Advisory Board Company, we work with more than 3,000 hospitals and health systems across the United States on comprehensive technology, research, and services solutions to address their strategic challenges. With the Build Health Challenge, we are striving to change healthcare fundamentally, with radical interventions at the source of the problems that our members face with population health management. Many of our members are in the process of redesigning their care delivery models so they can transition to proactively managing the health of their patient populations. Even the best health systems can struggle to improve care outcomes and reduce costs across their patient populations unless they engage both patient and the community on managing the patient's health. This has been a key insight. At a time when few health systems have internal resources to address non-clinical health factors, Build offers systems new means for partnering with others committed to these same goals of improved community health. We are thrilled with the collaboration that Build has promoted in the 18 funded communities. Each community has an inspiring story to share and insights that the Advisory Board's health system members can adopt in creating their own concrete metrics and detailed plans for effective community partnerships. For example, 3 of the implementation awards are going to communities that are working to reduce avoidable emergency department and other hospital visits for asthma, chronic obstructive pulmonary disease, COPD, and other conditions by addressing the upstream factor of unhealthy and unsafe housing. Health systems are becoming involved in non-traditional tactics, such as working closely with housing authorities to provide data to identify buildings that are likely to pose significant health hazards, and partnering with community organizations and health departments to strengthen rental inspection and code enforcement. These partnerships will also provide education programs and, in some cases, identify resources for housing maintenance to prevent health issues. I'm excited to see the Build Health Challenge drive innovation through these creative partnerships and to share these promising models for improving community health with not only our member hospitals and health systems, but also the rest of the country. We at the Advisory Board are tremendously proud to have worked alongside the 4 foundations to create something that we hope will, over time, fundamentally redefine the solutions to some of the most intractable health problems in our country. We are excited by the work that has been initiated by today's 18 winners and all those who will follow. Thank you all for your efforts. I'm also happy that several of my colleagues are here today. You hopefully have had a chance to meet them. I hope you get a chance to meet them, all of whom have worked really hard along with our partners to make today happen. And again, I just want to convey all of our enthusiasm for being here. So thank you very much.
Thank you, Robert. Next, we have Ari Simon, who is Vice President and Chief Program and Strategy Officer at the Kresge Foundation, where he directs Kresge's efforts to explore new forms of cross-disciplinary and place-based work, which sounds very relevant to what we're talking about today. Ari?
Thank you, Ed, and thank you all for joining us today for the announcement of the first cohort of the Build Health Challenge awardees. My name is Ari Simon, and I'm the Vice President of the Kresge Foundation. Kresge is so proud to be a founding partner of Build, and to contribute $4 million in grant and loan funds towards the success of this exciting and critical initiative. So the Kresge Foundation is a $3.5 billion foundation that works to expand opportunities for low-income people in America's cities. We pursue this goal through grant-making and social investments in arts and culture, education, environment, health, human services, and community development in Detroit and nationally. Kresge is supporting the Build Health Challenge through our National Health Program, represented here today by David Fukuzawa and Chris Cable, who work with communities to achieve their vision of health and equity. The challenge is a signature initiative in the health team's priority to accelerate community-centered approaches to health. So it's my honor and real pleasure today to introduce the first Build Health Challenge Award recipients. These communities represent a really remarkable diversity of geographies touched, racial and ethnic communities engaged, and upstream health factors addressed. We believe they'll help develop new models to improve population health, reduce health costs, and promote health equity. So I'd like to ask awardees to stand briefly as I recognize your community, and also ask everyone to hold applause until the end. So first, the Implementation Awards. In Ontario, California, Partners for Better Health, San Antonio Regional Hospital, and San Bernardino County Department of Public Health will be improving access to healthy, affordable food and safe places to be active in order to reduce high rates of obesity-related disease. In Cleveland, Ohio, Environmental Health Watch, the Metro Health System, and Cleveland Department of Public Health will be improving housing conditions in the Brooklyn Center neighborhood. In my hometown of Des Moines, Iowa, the Polk County Housing Trust Fund, Mercy Medical Center, Unity Point Health, and the Polk County Health Department will be collaborating to reduce asthma-related hospital visits by improving social and environmental factors in the East Bank neighborhood. In Albuquerque, the Adelante Development Center, Presbyterian Healthcare Services, and Bernalillo County Office of Health and Social Services will be improving opportunities for healthy eating and active living in Albuquerque's Southeast Heights and South Valley neighborhoods. In the Bronx, New York, the Northwest Bronx Community and Clergy Coalition, Montefiore Medical Center, and the New York City Department of Health and Mental Hygiene will improve housing conditions and energy efficiency for low-income residents in 5 Bronx neighborhoods. In Houston, the Houston Food Bank, MD Anderson Cancer Center, and the Harris County Public Health Department will be creating a food system in North Pasadena, Texas, that expands economic opportunity while increasing access to healthy food. And in Oakland, California, the East Bay Asian Local Development Corporation, Sutter Health, and the Alameda County Health Department will promote economic development and reduce health disparities in West Oakland. So a quick round of applause. So next, the Planning Awards. In Los Angeles, the National Health Foundation, California Hospital Medical Center, and the Los Angeles County Department of Public Health will develop a plan to create better opportunities for healthy eating and active living in South Los Angeles. In Chicago, the Legal Assistance Foundation, Cook County Health and Hospital System, and Chicago Department of Public Health will integrate legal, medical, and public health services to improve the health of residents in the New City and East Garfield Park neighborhoods. In Baltimore, the Druid Heights Community Development Corporation, University of Maryland Medical Center, and Baltimore City Health Department will develop a comprehensive youth violence prevention plan. In Springfield, Massachusetts, HAP Housing, Bay State Health System, and the Springfield Department of Health and Human Services will improve public safety and spur economic development in the Old Hill neighborhood. In Detroit, the Eastside Community Network, St. John Providence Health System, and the Detroit Department of Health and Wellness Promotion will collaborate to create job opportunities, improve access to healthy food by taking advantage of the transformation of Chandler Park in the city's east side. In Seattle, the Interim Community Development Association, Swedish Medical Center, and Public Health of Seattle/Kidd County will develop a plan to improve economic development and housing in the city's International District. In Portland, the Oregon Public Health Institute, Providence Health and Services, and Multnomah County Health Department will work to reduce health disparities in East Portland by expanding access to affordable housing, green spaces, and healthy food. And in Miami, the Florida Institute for Health Innovation, Jackson Health System, and the Florida Department of Health in Miami-Dade County will collaborate to improve public safety in the Liberty City neighborhood. Again, a round of applause. So congratulations, and I'd like to introduce Amy Latham from the Colorado Health Foundation, who will introduce the Build Health Challenge awardees from Colorado.
And I'll just add a minute of about Amy. She's leads the healthy living, health coverage, and healthcare learns that seek to ensure that all Coloradans achieve health. And we're really excited to have a local foundation as a partner in this nationwide effort.
Good morning. It is my honor and privilege to be here this morning with you all on behalf of the Colorado Health Foundation. We are so extremely excited to be part of this innovative national collaboration. I remember vividly hearing about the Build Health Challenge for the first time last fall. My colleague Suzanne White brought it to our attention, and each time she told us about it, we learned a little bit more and we got a little bit more excited about it. Really, not just the opportunity to support the incredible work that's going on in Colorado in this area, but really to learn from the communities around the country. What an incredible opportunity for us as a state-based foundation to be part of this. We're able to make a grant in the amount of $1 million to support a cohort of Colorado communities. We are so excited about the work that these three groups are doing, and it is my honor to now introduce them to you. So again, please stand. In Aurora, Together Colorado, Children's Hospital Colorado, and Tri-County Health Department will focus on improving the first 1,000 days of children's lives from pregnancy to a child's second birthday by increasing access to behavioral health screening and support in 3 zip codes with significant socioeconomic disparities. In Colorado Springs, YMCA of the Pikes Peak region, Live Well Colorado Springs, Penrose St. Francis Health Services, and El Paso County Public Health will mobilize their community by identifying and supporting community leaders to address barriers to services, health care, and safe environments. And finally, in Denver, the Civic Canopy, Denver Health's Community Health Services, and Denver Public Health will engage residents in 5 neighborhoods in Northeast Denver facing crippling early childhood adversity to leverage resources and ensure children are thriving by the time they enter school. Congratulations to these Colorado communities. The Colorado Health Foundation's vision is that together we will make Colorado the healthiest state in the nation. Now, we've clearly got some stiff competition from all the groups in this room, so we welcome that. And it really, truly, it has been a pleasure over the last day to get to meet many of the awardees from around the country. I think one of the things that we are most excited about is to learn from the work that's going on in states around the country and to bring that to Colorado. Our vision includes the word together because we truly believe that the only way for communities to reach their healthiest potential is through collaboration. The Build Health Challenge leverages this potential by engaging stakeholders at every level, the individual level, the healthcare system, and the community level. This work promises to strengthen connections across sectors and across states to identify solutions and best practices for improving the health of all communities. For the Colorado Health Foundation, BUILD is a natural extension of our work to support communities to prevent disease and improve population health. We focus our funding in 3 areas: healthy living, health coverage, and health care. And certainly the 3 awardees in Colorado have the potential to touch all 3 of those outcome areas. But the strength of their proposals really lies in the strength of their collaboration. Each of the communities demonstrated a strong commitment to engaging their residents to work together to identify and address barriers to health. We look forward to learning from our partners in this work in other states to strengthen relationships, collaborate, and build healthier communities together. Thank you all.
And I hope those who are at home on their web stream were standing in solidarity with their awardees in the room and using the Build Health, the hashtag Build Health to celebrate their success. I want to next introduce Michelle Larkin, who's the Interim Vice President for Program Portfolios at the Robert Wood Johnson Foundation, where she directs program activities focused on fostering connections between health and healthcare, catalyzing demand for healthy places and practices, engaging business for health, strengthening vulnerable populations, and eliminating health disparities. Thank you.
Good morning, everyone. Thank you, Ed. It's a pleasure to be here with you today. I love coming to events like this because it gives me an opportunity to hear from people in communities who our work touches as a national philanthropy, and also gives me a chance to connect with my sibling philanthropies so that we can actually learn the way that you are in your communities about how to work together. We're also learning that as local, state, and national philanthropies and thinking about how we can do a better job helping you to accomplish your community's goals. As Ed said, I'm Michelle Larkin. I am the Vice President for Program Portfolios at the Robert Wood Johnson Foundation. And my job today is to talk to you a little bit about how we selected communities to support through the Build Health Challenge and how this process fits with the Robert Wood Johnson Foundation and our vision to build a culture of health in our nation. Together with our funding partners, we released a call for applications for this effort in November of this year, and I have to say we not only had a tremendous response, I think to some degree it was overwhelming. We had over 1,500 people on our first series of webinars. And that's a lot of interest across the country in how to think about changing health within communities. And from that, we had 319 initial applications. So for those of you who have been acknowledged today, you should be really proud because you were able to compete through the challenge. And there were a lot of folks within that who were doing great work. And so it was a very challenging decision for all of us to make. That interest across the country is really about new ways to engage communities and think about how we promote health, one that involves multi-sector collaborations between hospitals and health systems engaged with community members, community-based organizations, public health, and others, using data to understand the root causes of health inequities and also to understand how we can discover together solutions to make a difference. As I said, the selection process for the Build Health Challenge was not an easy one, so to help us as funders, we actually convened an expert panel representing healthcare, public health, and community-based organizations. These experts provided insights into the development of not only the call for applications, but they participated in the review and selection, and it was really a robust set of discussions to get us to the final awardees. And I have to say that one of the things that I heard from Amy Slonim, who is our person working on this initiative, is that we don't often hear from our selection panels that they want to continue to stay involved in an effort after the selection because they're busy people. But they really were eager to learn from what you're learning, to be able to take those lessons and, borrow them in some way for their own improvements in their communities. So just to remind everyone, the awardee selection criteria, primarily related to the pillars of the Build Health Challenge, required that the efforts be bold. That means including novel partnerships that tackle community health challenges in innovative ways for each of your communities. And that's different within each community. It means making upstream the focus, addressing community factors from affordable housing to violence prevention to access for healthy foods that shape health before any clinical intervention is necessary. It had to be integrated, meaning that strategies integrate the capacities, competencies, and resources of those community members, the partner organizations, because that's how change is going to be sustainable. Local, with a focus on neighborhoods, census tracts, or zip codes that are experiencing significant obstacles to health. And as I mentioned a moment ago, data-driven, reflecting a commitment to share and use data to define the problems, but I think more importantly, to target interventions and provide opportunities for continuous learning and improvement. And we are so thankful and appreciative to the expert panel for their time, their thoughtfulness, their energy, their attention, and their desire to stay engaged. And of course, to all of the communities who applied for the challenge and are working to improve health in new and thoughtful ways. At the foundation, at the Robert Wood Johnson Foundation, we're particularly interested in community-level work, shining a light and holding up communities that are working in new ways to improve health, and that I think are really engaging in new partnerships that we don't often think of being engaged in health, like education systems, housing, transit authorities, public health, healthcare systems, and how we can bring them together. Our vision is that we create a nation where it has a culture of health that enables all in our diverse society to live longer, healthier, more productive lives. I know when I use that term, a lot of people say, I have no idea what that means. And you know what? It's intentional, because it means different things to your community than it does to my community. So I said at the beginning that I would connect this to the Robert Wood Johnson Foundation for you. So for us at the Robert Wood Johnson Foundation, a culture of health is one in which being healthy and staying healthy is valued by our entire society. That the health of the population is guided by and guides public and private decision-making. That good health flourishes across geographic, demographic, and social sectors, and that we all have the means and the opportunity, no matter what zip code we're in or what census tract or neighborhood, to make healthy choices that lead to healthy lifestyles and healthier communities. And finally, building a culture of health depends on individuals, government, healthcare, schools, and organizations working together to foster healthy communities. It's exactly the kind of work and collaboration that each of you is doing in your communities, which is why you're in this room. Because you took the opportunity to apply for the Build Health Challenge, but more importantly, you took that opportunity in your communities to create a healthier community and focus on the front end of health and those upstream challenges. We realize that health is a fundamental element of our everyday lives, and strengthening the connections is critically important for a community to thrive. This includes building and supporting new partnerships and innovative types of partnerships, both within communities and at state and national levels, like the partnerships that we've created as funders for this initiative. The Build Health Challenge is exciting. It's an opportunity to learn from and with these communities, and I thank you for that. And we are thrilled to be a part of it, and I am really looking forward to what you're going to do through this challenge and what you'll do beyond this challenge. So thank you for all of your hard work, and thank you for coming today, and thank you for setting the lessons and the bar high for communities across the country so that they can join you in creating a healthier nation. Thank you.
Great. Thank you, Michelle. So I get to give you a minute of my own perspective from the de Beaumont Foundation, and then I get to introduce my former colleague and our guest, Karen DeSalvo. I think most of you met yesterday a majority of the de Beaumont Foundation staff who were there throughout the day, and I want to mention Dr. Jim Sprague, who is with us today. You may not have met yesterday. He's our board chair, and I joined de Beaumont in February and had the pleasure of learning of a process already underway. And I think one of the first things I did was sit in on one of the review panels and heard about the great work going on in communities across the U.S. So it's really exciting for me to be here today to see the product of that. Just a couple thoughts. De Beaumont Foundation is really focused on the public health system side of today's partnership discussion. And I think no one in this room comes without knowing that we, as individuals and as society, we ignore prevention at our own peril, and we've done so often. Increasingly, we recognize that to keep people healthy, we need to address the factors that have the greatest impact on health, things like housing, employment, transportation, food access, prevention, health services. In short, it's the upstream in build, the upstream U in build. And I think we've all hit on that same theme. We all want high-quality medical care to be there when we need it, but we can have a greater impact through efforts to build communities that keep people safe and healthy, and I think that's what this program is about. This takes concerted effort that breaks out of our traditional modes, and it requires us to work across sectors to use the assets of the whole community rather than working in isolation in pieces of the community. The Build Health Challenge is designed to take a decades-long discussion of collaboration between healthcare and public health and communities and put it further into reality. And I think many of you have already been on that path, and hopefully this will really help accelerate that. We seek to maximize the strength of community leaders, our healthcare and hospital leaders, and our public health and community leaders to achieve our goal of a healthy, thriving population. The governmental public health system is an oft-hidden asset, partly because we're not particularly good at advertising what we do, but partly because of resources and capacity. But working in the background to control outbreaks, keep our food safe, and other essential functions. But we believe that these agencies can be an essential participant in the transformation of our healthcare system and in broader efforts to improve the health of communities. And that's why I think it's important to have strong public health partners involved in each of these efforts. These agencies can bring together data from across the community to help understand health needs, can have a perspective on the community that includes both medical and non-medical factors, can exert influence on public policies, and help shape community conditions as well as the availability of health services, and can convene and motivate partnerships that cut across sectors. So I think in a really important role. But to be most effective in bringing about change, governmental public health agencies need to move from the background into a more active role. And you'll see that happening in these build communities across the US. Public health leaders in these build communities are on the vanguard of what health departments can be and can contribute to important health systems transformations. And we hope to learn from these agencies and their work in these impressive build collaborations and to ensure that this learning is shared nationally to further expand the role of health departments in health systems transformation. For the de Beaumont Foundation, BUILD is a follow-up to the successful launch of the Practical Playbook. And we hope this online tool that supports integration of primary care and public health can be helpful to build communities, and that we can also learn from the experience in build communities to further reinforce lessons we can carry across the country. So finally, the health problems of our communities are complicated. They involve a complex interaction of economic, social, medical, environmental, and other factors. But collaboration is complicated too, and I'm sure those of you who have assembled coalitions have experienced the growing pains and the frustrations of it requires diplomacy, it requires patience, compromise, and getting familiar with topics and language that is not always familiar to us. But we found that simple solutions haven't really met the needs of our communities. So our strategies and collaborations need to match the complexity of those problems, and I think each of you are well along that path. The 18 BUILD grantees, the awardees across the US, are tackling these complex problems in, I think, very innovative and sophisticated ways. And we can learn from each other, find strategies to improve these collaborations, and from this work we can improve the health not only of the 18 communities, but show the way for countless others. So I think it's, again, congratulations to all of you, and welcome to what really is a challenge. Getting here today and getting through this, rigorous process was a challenge, but I think you're all facing the most important challenge, which is actually showing how you can accomplish the goals that you have set for yourself. So with that, it's now my pleasure to introduce our keynote speaker today, Dr. Karen DeSalvo, I think known to all of you, represents the upstream, I believe, and the data-driven letters of BUILD, so a particularly well-suited person to speak with us. She's the Acting Assistant Secretary for Health in the U.S. Department of Health and Human Services, and also simultaneously a very busy person, the National Coordinator for Health Information Technology. Dr. DeSalvo is a physician who's focused her career on improving access to affordable, high-quality care for all people, especially vulnerable populations, and promoting overall health. Her team is at the vanguard in the health IT world of bringing data and health IT to the service of population health which is a core tenet. It's the D of BUILD. It's a pleasure and an honor to welcome her here today to join us in helping further the BUILD Health Challenge.
Well, thank you, Ed. It's really good to see you. We miss you at HHS, but I couldn't be more delighted about where you've landed from a selfish perspective. And it's nice to see all of you. It's really an honor for me to be here today. You all are kindred spirits, and I just want to start by applauding what you have proposed to do and what I know you're going to be successful doing, and I just can't wait to see what comes out on the other side for learnings for the rest of the country. This work that you're doing to engage communities and build partnerships to improve health outcomes is really vital and a very often overlooked aspect of improving the public's health. Initiatives like the Build Health Challenge, made possible by these partnerships of the Advisory Board, the de Beaumont Foundation, the Kresge Foundation, the Robert Wood Johnson Foundation, and the Colorado Health Foundation, talk about collective impact, are key to helping to reorient us from the more traditional model of public health towards understanding how it can be a backbone to advancing the factors that influence health. I had an early exposure to how closely the health of an individual is linked to their social determinants of health, and it's really shaped my outlook to public health ever since. I saw firsthand the challenges of how social determinants impact health outcomes for populations during my training and my practice at Charity Hospital in New Orleans. I had 7 years of National Health Service Corps experience in a continuity care clinic with some of the most resource-challenged people in this country. Most of them were just beginning to help open my eyes to the challenges and experiences of their life, and it marked me forever in a good way. I learned very quickly that their diabetes was unmanaged not because they didn't want to take their medicine or didn't want to follow a diet. It was because they didn't have the money to buy the medication, or they didn't have access to healthy food in their neighborhood, or they didn't have electricity at their house, or they didn't have a house. Even if they were compliant on their blood pressure medicines, they often went home to a salt dome or shopped at a corner store and had only accessible foods that were loaded with salt, or they ate fast food, which was often cheaper than even cooking for themselves. They didn't have safe neighborhoods or playgrounds in which to exercise. Buildings in which they worked encouraged them to use the elevator because by design the stairwells were hard to find, and that reduced their energy expenditure. And they missed appointments because the bus was late, and that meant we couldn't get them back into the system for an entire year, so they did what any rational person would do, go to the emergency room to get their meds refilled and have discontinuity of their care. Many of them suffered from situational depression and anxiety because they lived in a constantly stressful environment, ripe with violence and trauma that complicated their illness, their health, and their self-management. And they were an example of what is happening in so many communities in this country. Despite dramatic progress in health in the last century in America, we are actually losing the battle for the public's health. We're at number 34 worldwide in life expectancy. Preterm birth has increased by a third in the past few decades. And by 2030, almost half of our population will be obese with the consequent chronic and cancer health challenges. And for all of that, we spend twice as much as our industrialized peers on health care. The public is not as healthy as any of us would want them to be, and indeed is getting sicker and at a very high cost. And so why have we stalled out? For all of its progress, medicine clearly has challenges, and the expectation is in medicine to generally do more, see more, be rewarded for sickness, as opposed to being rewarded for health of individuals and communities. And even when practiced at its best today, it probably only can account for 10, maybe 20%, we'll argue about the models, of a person's health outcomes. And we have such a ways to go to see that it can have partners to improve overall health. There's been a movement in the right direction, and initiatives like the Build Health Challenge are seeking to close that gap and engage communities to build partnerships to improve health, leveraging medicine, public health, and other sectors, all to the end goal of advancing our public's health. And we can do it. You can do it. You are doing it. And I know that you can personally because we had some opportunity in New Orleans. to rebuild our healthcare system 10 years ago this summer after we had a visit from Hurricane Katrina. At the time of that disaster, horrific as it was, our community stood up and looked around and realized that we had an opportunity to build better for the people we had been serving in our healthcare system and our public health system and help them achieve better health. We sought to use evidence that focused on creating system-level changes that would provide access to better care. It was a major gap in our community, having access to primary care and prevention. And so we focused on access to health insurance, to support care models that were neighborhood-based primary care that would allow for teams and coordination, that would reward value and not volume, to have medical homes for everybody in our community that would provide primary care and behavioral health services and be a part of a medical neighborhood beyond. We digitized the care experience. It's taken me a year to be able to say that word. We digitized the care experience to bring information to doctors, health systems, and patients to make decision-making better, easier. And we focused on metrics that would let us know that the care was actually better for everyone involved. And we did all of that, except for some of the financing, but that's a different talk. And the result of this today is that there are now dozens of neighborhood-based care sites in our community that provide care to some 10% of the greater New Orleans population who used to predominantly rely on the emergency room for their care. It's a recognized model of excellence that's done collaboratively, collectively. They're using electronic health records and having health information exchange and doing quality improvement work collaboratively. The clinicians and doctors in that environment are not only able to practice medicine as part of a team, but they have built bridges with the community and the faith-based organizations in their neighborhoods that can support patients and consumers when they leave those four walls. Over time, the indicators have improved, reductions in visits to the emergency room, increase in preventive care indicators like mammography, improvements of quality of care for the major scourges like cardiovascular disease and diabetes. But all along this journey, I became to realize very clearly that though this was good, better medicine was necessary. It was not going to be sufficient to improving our public's health. And so that's why you all are here today and why I'm here today, because as health professionals, we understand that we can provide and prescribe the best, highest quality care, provide the best, highest quality public health, but it's really for naught if the people that we are caring for live in unhealthy and unsafe environments. The major contributors to poor health and premature mortality depend on where you live. Things like access to good housing, transportation, the public safety, protection from environmental toxins like lead and smoke. And so to advance America's health, we have to do more than just provide quality care. We have to address the non-medical social determinants of health like safety, transportation, housing, education, healthy food, the list goes on. And public health has a critical role to play in all of this. Nationally, it will have a great deal of work to do in order to be ready to be a strong partner, but it, as Ed alluded, does save your life every day. We just don't know it. I'm still trying to find a tagline for public health. But it really has the opportunity and I think the responsibility to do more to meet this challenge of really advancing health for everyone. It has become, over the course of decades, disconnected from healthcare and medicine in most communities and from many other key sectors like business and transportation and urban planning, but it really wasn't always that way. Our successes at improved survival and reducing the burden of disease can be traced to basic infrastructure efforts led by public health. If you think about clean water and sanitation systems, those were urban planning projects that were led and initiated by public health. If you think about how we tackle tuberculosis in this country, yes, medicine helped, but not nearly as much as good housing policy. And over time, public health became increasingly underfunded, overlooked, and unprepared for some of the challenges it was meeting, and medicine became at the forefront for advancing the public's health. But knowing what I knew about the challenges that my patients faced, our communities faced, that medicine was going to be necessary but not sufficient, it is one of the reasons I took on the challenge of being health commissioner in 2011 in New Orleans, because I wanted to be a part of helping public health be at the table and be strong, not only for our patients and the communities I knew, but really for the entire city. That's what's so beautiful about public health. It's accountable to everyone in the community. We needed in our city a public health system that would be strong and would be a good partner to medicine to continue to advance the public's health. And it did take a lot of work in partnership with community, and we were initially labeled as the worst government in the nation, including the public health department. And we are now, that health department, one of best in class. We're one of the few accredited health departments in the country, which is a rigorous national process. It happened in 3.5 years from not only the team, but from the community who came behind to make sure it would happen. And now that health department is ready to be an able and capable partner and a leader in that community to advancing the public's health. I've been at HHS now for about 18 months and working nationally on issues that are strikingly similar to what we did in New Orleans. It's one of the reasons I came here, was to leverage lessons learned from that community and in the wake of disaster to see if we could apply some of that nationally. Just as we focused on in New Orleans, getting people access to high quality, affordable care is necessary. We've been working on that at HHS, and in my tenure in the department, I've had the opportunity to co-lead an effort around delivery system reform. People get coverage, access then to what? Let's make sure that it's not more of the volume-based system that is piecemeal and transaction-based, but really a system that's able to coordinate their care and to focus on managing populations to reduce the burden of disease and simultaneously make it more affordable so that we can use those savings to reinvest in other components that affect health. This is going to help medicine evolve to be a better partner, one that's not thinking about the patient in front of them in the room, but really about the population at large. And you see already that what's happening in communities where value-based payment and population payments advancing, their medicine is encroaching into community and wanting to understand the social determinants, recognizing that there's more to health than healthcare, and that understanding where their patients live, learn, work, and play, and being a partner in impacting that will actually improve their business model. And so I know also that I need to make sure that public health is ready to be there at the table along the way. And so I think this is a really tremendous time in history for all of us to stand up, whether from public health or whether from other sectors, and make sure that we are preparing public health to have a seat at that table where they're so hungry to be. They're going to have to be more outcomes focused. We're going to have to think about new ways to blend funding so that they can have more flexibility on the ground in the front line. We're going to have to bring data to bear so that we can make better evidence-based decisions and have evidence-based policy decision-making, whatever the disease, whatever the condition that we need to address. And government's going to need to consider how it can move towards a better model for funding public health, again, that is going to allow them to integrate not only within themselves, but work more collaboratively across other sectors so that they can really address where people live, learn, work, and play, and receive care. Even if you're not a health professional or a public health professional, you are a part of the public's health. That's the reason that you're here today. And so I'm asking you all to continue to do what you have written in your documents, to be bold in your thinking, to address upstream issues, to integrate across programs and sectors, to engage with your local communities, including local public health and local health care, and be data-driven in your approaches so that we can, where possible, replicate and show success to the world so that we can continue this movement. This is precisely what you're doing every day, and I want to congratulate you all for the collaborative efforts you put to board just to put your applications together and to be, because I know. There's probably a few scars, and to advance health and really remind you to make sure that you're keeping everybody engaged using data and the basic tenets of moving towards a shared vision. So congratulations to all the awardees for that vision that you've set out, for your commitment to hard work, and to your commitment to really moving upstream. I'm looking forward to seeing the results of these projects that you engage in, and really to the culture change that's going to happen on the ground in your community. And that particularly, I'd love to hear more about how you measured and marked that there was a new movement afoot, a social movement around advancing the public health. So as a doctor, as your public servant, I look forward to being your partner in this broad effort to improve the public's health and help me restore why I went into medicine, to bring health, not just care, and why I went into public health. And I do believe that this is a legacy that we can all leave for generations to come. Thank you all very much.
Thank you so much, Karen. And being a senior official at HHS is the definition of the Japanese just-in-time inventory model. You move from one place to the next, and we really appreciate you taking the time to be with us. Thank you. So what's great about listening to Karen is knowing that a person who is helping lead delivery system reform and speaking at the highest levels in health policy in HHS and elsewhere actually is not only talking the talk, but has been there and walked the walk and done this and understands the challenges that you're all facing. So I think this was advertised as the Build Health launch, and I think what she's given us is a great way to launch back to actually the practicalities of what we need to do. So that brings our formal part of the program to a conclusion. I want to thank our panelists for being with us. I think we're all going to be mingling and here for a little bit. If you want to ask us questions, there's a follow-up later. I want to thank the folks back in the 18 communities and others that are watching us by web, and encourage you to continue the conversation on #BuildHealth. And with that, I think we should consider ourselves launched and bring this to a close. So thank you.